Welcome, Cik Zafri. So can you give us a short description about what you see are the critical challenges for Etiqa in the context of health and mental health, and especially in the context of Islamic finance?
Our mental health requires long-term care. We believe that the main reason why it has been so long for mental health condition to appear in takaful certificate is the expensive cost of treatment, which can be ongoing for years.
And already before COVID hit Malaysia, you've taken that leadership position and included mental illnesses into your critical illnesses list. What made you do that?
We saw the growing need to provide coverage for mental illness due to the increasing trend in the numbers of Malaysians suffering from mental health problems. We were well aware that staggering 29.2% of Malaysians were suffering from mental illness.
Are there other data points that you can share to highlight or describe the extent of this issue in Malaysia today?
In Malaysia, the Malaysian Ministry of Health expected mental health disorder to be the second highest form of health problem affecting Malaysia after heart diseases. Since the battle with the COVID-19 pandemic, MOH shared that Malaysians have been affected psychologically and emotionally. What I find devastating about mental illness is that many suffer in silence. Mental illness is a subject that has traditionally been something difficult to talk about. There may be stigma associated with the condition and a lack of understanding. However, it is seemed to be slowly changing as this topic being more widely spoken about, and there are more and more avenues for people to seek help.
What about your particular focus on mental issues from an Islamic viewpoint?
If we are looking at the principle of Sharia or Maqasid al-Sharia, among the key objectives of Sharia are to protect the life, or they call it al-naf, and also to protect the intellect, al-aqal, of a person. So a sound intellect contributes toward a sound life. In other words, affected mental health will lead to an affected sound mind, which generally leads to poor decision making. So based on this, we can appreciate how Islamic law protect the sanctity of intellect and life. Mental health is part of the necessity, or daruriyat they call it.
Wow, okay, fantastic. Well, Cik Zafri, thank you very much for sharing with us what Etiqa Family Takaful is doing in this field.
Thank you, Azran.